Let's be honest. When you're in that hospital gown, you're feeling pretty vulnerable. You are putting an incredible amount of trust, your health, maybe even your life in the hands of doctors and nurses. But what happens when something goes wrong? And more importantly, when is a bad outcome just an unfortunate accident? And when does it cross that line into medical malpractice?
And that is the huge question we're going to dig into today. I mean, how does the legal system actually draw that line? How do you tell the difference between a sad but unavoidable complication and a genuine harmful mistake? We're going to break down the legal ideas that separate the two.
Okay, so here's how we're going to tackle this. First, what is medical negligence really? Then, who's on the hook? The doctor, the hospital. We'll also touch on your role as the patient and the doctor's key defense. And finally, we'll wrap it all up with the 4 things you absolutely have to prove for a malpractice claim.
All right, let's dive right in. What exactly is medical negligence? You know, it's a phrase that gets thrown around a lot, but legally speaking, it's not just any old error. Nope, the law has a very specific definition that separates a simple mistake from something much more serious. Okay, so it all boils down to this one key idea, the standard of care. Think of it like a measuring stick for doctors. The big question the law asks is this: what would another reasonably skilled doctor in the same field have done in this exact situation? If the care you got falls below that standard, that's when we start talking about negligence.
Okay, let's get real with some examples. A surgeon operates on the wrong part of the body. Yeah, it's a total nightmare scenario, right? And legally, it's an open and shut case. There's just no way that meets the standard of care. That is about as clear an example of negligence as you can get.
Or, how about this one? A doctor completely misses an obvious tumor on an X-ray. Because of that, the patient's diagnosis is delayed for months, and things get way worse. Again, that's a failure to provide that baseline level of skill. It's another pretty clear case of negligence.
But you know, medicine is rarely that black and white. It's full of gray areas. So what about this? A doctor is dealing with a super complex, rare case. They have to make a tough judgment call. They choose a course of action that seems totally reasonable, but the patient still has a bad outcome. Is that malpractice?
And here's the absolute key takeaway. As long as that doctor's decision was something that other competent doctors in that field would consider a reasonable choice, then it is not negligence, even if the result was tragic. This is so important. A bad outcome does not automatically mean malpractice.
Okay, so let's say that line does get crossed. Who's actually responsible? Is it just the doctor who messed up? Or can you go after the hospital, the institution itself?
All right, let's paint a picture. A nurse who works for the hospital gives you the wrong dose of medicine. Who do you sue? The nurse? Or can you sue the hospital? Well, the answer is, very often, yes, you can sue the hospital. And it's all because of this really important legal idea.
It's called vicarious liability. And it's actually pretty simple. It means the boss, in this case the hospital, is responsible for the mistakes its employees make while they're on the job. The law basically says, hey, hospital, you hired them, you trained them, so you're responsible for them.
So what this means is you often have 2 different kinds of liability. You've got direct liability, where the doctor or nurse is on the hook for their own mistake, but you also have vicarious liability, where the hospital is on the hook for its employee's mistake. And in a lot of these lawsuits, lawyers will go after both.
Okay, so we've talked a lot about the doctor and the hospital, but what about you? The patient's role is actually a huge part of this. What you knew and when you knew it can make a really big difference in these cases.
So imagine you're going in for a pretty standard procedure. Everything goes perfectly from the surgeon's perspective, but you end up with a complication. A rare one, sure, but one that was actually listed as a possibility on those forms you signed. Is the doctor still at fault?
And the answer is probably not. And that's because of a legal defense called assumption of risk. It's pretty much what it sounds like. If you were told about the possible risks and you said yes anyway, the law says you assumed those risks. This is what protects a good doctor when a known complication happens, even when they did everything right.
And that brings us to what is, without a doubt, the doctor's most powerful defense in any malpractice case. It's the other side of that same coin we were just talking about, and it all comes down to making sure you, the patient, are fully informed.
So think about it. A known risk happens. What's the doctor's get-out-of-jail-free card, legally speaking? What's the one piece of evidence that proves the patient knew exactly what they were signing up for?
It all comes down to two words: informed consent. This is everything. It's the absolute foundation of modern medicine.
And listen, informed consent is so much more than just signing a piece of paper. It's proof of a conversation. It's the doctor saying, here are the risks, here are the benefits, and here are your other options. When you sign that form, you're legally saying, yep, I get it, and I'm okay with those known risks. And that's a huge legal shield for the doctor.
And this is why this should matter to you, personally. Next time a nurse hands you a clipboard with a stack of papers, don't just sign on the dotted line. Remember what you're actually doing. That's not just red tape. That's a legal document. It's the cornerstone of your entire agreement, where you're saying, I understand the risks.
All right, let's pull all these threads together. To actually win a malpractice case, it's not enough to just feel like your doctor messed up. You have to legally prove 4 distinct things. It's like a 4-legged stool. If even one leg is missing, the whole thing falls apart.
So here they are, the 4 pillars. Number 1 is duty. Pretty simple. You had to actually be their patient. Number 2 is breach. This is where the standard of care comes in. They failed to meet it. Number 3, harm. You have to have suffered some kind of actual injury. And number 4, and this is often the hardest one to prove, is causation. You have to show that their mistake is the direct reason you were harmed. Gotta have all 4. No exceptions.
And I really want to hammer this point home. Malpractice is not about proving the doctor is a bad person. It's not about proving they meant to hurt you. It's all about competence. The law doesn't care about their intentions. It only asks 2 questions. Did they fail to meet the standard of care? And did that failure cause an injury? That's it.
So, when you understand all this, when you know the difference between a known risk and actual negligence, it really changes things, doesn't it? It makes you a true partner in your own healthcare, not just a passive patient. So I'll leave you with this to think about. Now that you know all this, what are you going to ask your doctor the next time you see them?